This is Carlos E Alfonso. I'm one of the interventional cardiologists and the cardiology fellowship program director here at the University of Miami Hospital and Clinics, UHealth Tower. I have with me three of our excellent fellows, Sibi Krishnamurthy, Walid Ibrahim, and Adedapo Iluyomade, who are here to discuss with us some of the controversies that are surrounding, the treatment of our patients and their medications. So I just want to highlight that we've been using in this era of COVID is conference and video conferencing to deliver care and education. But I think one of the questions that we really had was a lot of conflicting reports on what to do with our patients that are taking ACE inhibitors and ARBs. Walid, what's the concern out there in regards to ACE inhibitors and ARB?
Sure. There is now in the era of the COVID virus pandemic that patients who are using ACE inhibitor and ARBs are in high risk of severe infection, given that ACE inhibitor and ARB increase the expression of tissue for an ACE inhibitor 2 receptors, which being used by the virus to infect the cells. So given this theory, now there's a concern, and in China, there is some patients who are diabetic and hypertensive who've been on ACE and ARB, and ARB has high mortality rate and severe infection. So that's what's raised the questions now, given this pandemic.
Great. Well, thanks. Yeah. So to summarize, I think that there's some concern with the medications because they use the same receptors as the virus. And Sibi, is there any data in terms of what's the risk for patients with these medications? Are they at worse risk of having the virus, or if they have the virus and are taking these medications, is the outcomes worse or better?
That's the big question. And currently right now, there isn't enough data or really any data or evidence to prove for beneficial or harm. There are studies that have been done with an animal population that have shown that there is an upregulation of this ACE2 receptor that's going into the viruses with being on an ACE inhibitor. The problem is, because there's no data or evidence one way or another, we don't want to, immediately label this as a harmful medication. In fact, some people are even conjecturing that there is a beneficial effect of ACE inhibitors and ARBs for protecting lung injury in this injury. Granted, we don't have data or evidence on that either.
Great. So Dapo, can you kind of summarize? I mean, with the absence of data, as Sibi has mentioned, what have the professionals recommended, and what's our best, expectations or recommendations as of today?
Yeah, so we have two major position statements. One by the Joint Council from ACC, American Heart Association, as well as the Heart Failure Society of America. That was one statement, and then the other statement was made by the European Society of Cardiology, which are in parallel with each other, in that they do not recommend currently to stop ACEs or ARBs in patients who are already prescribed those medications until more data is available, especially in human studies and this particular population that we're dealing with now.
Okay, great. Yeah, so I think that in summary, while there is some concern, it's preliminarily. There's no data to say that our patients are at harm taking an ACE inhibitor or ARB. And based on multiple professional societies, including the American College of Cardiology and the American Heart Association, the recommendations is for our patients to continue taking their medications and not stop their medications. They should, if they're considering to stop, discuss with their physicians first. But there is a clear benefit in our cardiovascular patients to continue with their medications for their heart disease. Clarifies any questions that you all may have, and thank you guys for joining us and getting the word out.
Thank you.